Thank you so much for everyone for coming today. So my name is Julia Hartley, and I'm the Association Coordinator with the PEI Lung Association. Today's webinar is being hosted by the PEI Lung Association in partnership with Heart and Stroke. On today's webinar, we will start with a presentation from Mohammed Al-Hamdani, who will share the PEI specific results for the 2020-21 Youth and Young Adult Vaping Survey project. The purpose of this project was to better understand vaping behaviors, experiences, and product preferences among regular e-cigarette users 16 to 24 from across Canada, and was conducted by the Lung Association of Nova Scotia and made possible through funding by Heart and Stroke and other partners between November 2020 to March 2021. So today's webinar will also include updates from the Chief Public Health Office on vaping related legislative changes and the PEI smoking cessation program presented by Melissa Monroe-Bernard. All right, well, I'm turning it over to Sarah, who's just going to introduce our presenters, and we'll get started. Thanks.
Thanks, Julia. Thank you everyone for attending today. I'm Sarah Crozier. I'm the Manager of Health Promotions for Heart and Stroke here in PEI. We're grateful for you all attending today and for our partnership with the Lung Association to be able to provide you with the overview results of the overview of the PEI results of the Youth and Young Vaping Survey. I'll introduce both of our speakers at this time. So first we have Dr. Mohammed Al-Hamdani. I'm just getting this over, who is a graduate with a Master of Health Administration from Dalhousie University in 2011 and a PhD in Psychology from St. Mary's University in 2017. Following a Nova Scotia Health Research Foundation Fellowship, Dr. Al-Hamdani completed a MyTex Evaluate postdoctoral fellowship with the Department of Psychology and Neuroscience at Dalhousie University. In this role, his main project involved a series of novel studies aimed at examining the impact of plain packaging and attention and smoking behavior. He has published peer-reviewed studies, mostly in addiction policy, and successfully generated significant research and knowledge translation funding. Dr. Al-Hamdani is the current Director of Health Initiatives at the Lung Association of Nova Scotia and the Executive Director of Smoke Free Nova Scotia. Some of his health and wellness engagements include active participation in consultation for public policy. He also directed a number of extensive community and health system projects, including the Tobacco Cessation Assets Map. Our other speaker today will be Melissa Monroe-Bernard. Melissa is a registered social worker and health promoter with the Chief Public Health Office through the Department of Health and Wellness. She previously worked as a research coordinator at UPEI, leading provincial data collection for the Canadian Student Tobacco, Alcohol, and Drug Survey. Since joining the Chief Public Health Office in 2018, Melissa has led the tobacco file for the Health Promotion Unit and represents PEI on Health Canada's Tobacco Control Liaison Committee. Melissa is pleased that in her current role, she's able to continue collaborating with community and government partners to move important tobacco and vaping prevention initiatives forward in PEI. We were also supposed to have Laura McDonald present today. Unfortunately, she is unable to attend, but Melissa will cover her content. So with that, over to Dr. Al-Hamdani.
Thank you very much for the introduction. My aim today is to provide you with a snapshot of the findings of the Youth and Young Adult Vaping Survey and give you an opportunity to ask me questions. There's a lot of data, but I'll be trying to hit the main highlights. So just as full disclosure, and you can take a detailed look at it later at your own leisure, I am funded by non-for-profits as well as other health agencies. That would be my only perceived conflict of interest. So today, although this was a national initiative, I would be basically focusing on the findings from PEI. But as a background, most of us know that vaping is an epidemic amongst youth and young adults. About 20% of those in grades 7 to 12 have used it in the past month. And we started this project in 2019 in Nova Scotia to address this issue, and we looked at what vaping behaviors, perceptions, and experiences for users look like. And the project at that point yielded 5 recommendations, which are flavor bans and nicotine caps, implementing taxation, and the need for stronger enforcement at the sales level, as well as increasing minimum age to 21, and keeping an eye on the relationship between vaping and smoking initiation. So we expanded the project in 2020 to 2021 to the rest of the country. We pilot tested the survey for length, clarity, and meaningful answers, and then started the recruitment of the 16 to 24-year-old regular vapers. And the total sample from across the country was about 3,000 participants, with 273 from PEI. The recruitment involved social media ads, including Instagram and Facebook ads. We used the online platform Qualtrics for getting the responses. The questions included demographics as well as details on vaping behavior, experiences, and perceptions. We provided a prize draw for incentives as well as a guaranteed incentive for completed responses. And there was also age and gender comparisons as well as provincial comparisons. The mean age for the participants was about 19 years old. An equal number of youth and young adults participated. The majority of the participants from PEI were females. Most participants were employed and lived in urban areas. The average age of onset, so when they started vaping, was about 16 years old. Over half of the participants suggested that they've engaged in quit attempts that lasted over 24 hours, and with an average of about 3.77, or you could round it to 4 attempts on average per participant. When we looked at vaping frequency, we measured how many days they use the product per week, and how many times they use it per day or episodes per day, and then how many puffs they take each time they take it out of their pocket, backpack, or purse. And on average, there was more usage before COVID in comparison to during COVID amongst the participants. The spending was about $2,150 per week on vaping. Then the strongest influences on starting the vape were friends. That's the overwhelming majority of the participants. A much smaller percentage reported smoking cessation and social media exposure as the influencing factors for them to start vaping. The participants suggested that most of them, almost all, suggested that they've used someone else's vape or shared their own device, with an average of about 17 people that shared their devices with them. So just think about that for a moment during COVID and how concerning that would be. 82.4 participants used pod-based devices. Those are the small USB-like devices, Juul of which is a famous example. And about 42% of participants suggested that they've experienced negative side effects. About 1/3 stated that they were pressured to vape by their friends. And about 2/3 of youth said that their parents knew that they vape. So just think also about that for a moment, about how normalized this product is. The top 3 sources of social media exposure platforms were Snapchat, Instagram, and Facebook. If we look at age and gender comparisons with respect to vaping behavior, the highest days vaped per week, as well as puffs per episodes and number of quit attempts, were all by male youth. And the highest vaping episodes per day were highest among male young adults. During COVID-19, the days vaped per week and vaping episodes per day were lowest for female youth, and puffs per episode were lowest for male young adults, with females being the highest spender per week, female youth being the highest spender per week during or in general for on vaping, on their vaping products. More comparisons are with respect to sharing the devices and exposure to ads. Mainly, we saw an age difference with youth being having higher rates of sharing their products and being exposed to ads in comparison to young adults. And male youth reported the highest percentage of negative side effects experienced. When it comes to product information, most participants, overwhelming majority, prefer to use a flavored product at initiation and at present. About 38% of them said that they would stop vaping if flavors were absent from their e-juice. Only 11% added external content to their e-juice. So this highlights that basically most of them buy legal products, and 93% of them use nicotine-based products at present versus 81% at onset. 95% of the participants knew how much nicotine is in their product, and concerningly, 75% used 50 to 60 milligrams per ml, and that's of course amongst nicotine-based users. That's a very high percentage, and specifically PEI was higher than other provinces in that regard. This slide just shows you the most common flavors used by participants, both at onset and at present. You could see that berries, followed by mint and menthol, and then mango were the most popular flavors. And one particularly interesting trend here is the fact that mint and menthol goes up in preference between onset and the present time versus the other flavors, all of which go down in preference. And with nicotine concentrations, I had to just show it graphically just to demonstrate how concerning the nicotine concentrations that are used by youth and young adults in PEI. Female youth had higher preferences for flavors compared to the other groups, although again, all of them had high preferences for flavors. Female young adults reported the highest percentage of not continuing to vape if flavors were to be removed. So it was the most important for this age and gender group. Male youth reported the highest concentration or the highest percentage of high concentration of nicotine use. And that's about 86.7%. That's very high. In terms of drug use, there's a lot to report, but I'll focus on the 24.2% of vapers with a history of tobacco use that began smoking after vaping. So that shows a link between vaping and smoking initiation. There's also the average use of the average number of days of cannabis used in the past 30 days. It was 16, and for alcohol, it was 7 days in the last 30 days. With respect to age and gender differences for other drug use, females reported a high percentage of smoking after vaping in comparison to males, and young adults reported the highest use of cannabis and alcohol use in the past 30 days in comparison to youth. So this brings us to the discussion, which basically encapsulates the same findings that we saw with the Nova Scotia survey from earlier on, which is the need for increasing minimum age to 21, the need to reduce social sourcing, the need for nicotine caps to bring them down to 20 milligrams per ml according to the European Union standards, and flavor bans to reduce the attraction of youth to the products, taxation to decrease affordability, and social marketing campaigns to basically level the play field when it comes to warnings against the exposure to social media ads from the vaping industry. So some changes with respect to these measures have been made in different provinces and also some at the federal level, with PEI really being one of the leading provinces as far as some measures are concerned. So we do need to keep pushing for these policies, not only in PEI, but also elsewhere. And again, those are minimum age to 21, nicotine caps, taxation, and also we need social marketing to change perceptions about vaping products. And with that, I'll end the presentation, and I'll hand it back to Sarah.
So thanks to Julia for inviting Laura and I to be a part of this conversation today. Unfortunately, Laura was not able to make it today. She has something come up. So I am going to do my best to speak on her behalf about the smoking cessation program, but certainly if there's any more detailed questions about the program, I'm happy to bring those back to her after the presentation. So what I'm going to do is I'm just going to talk a little bit about the approach we take to tobacco in the Chief Public Health Office as it relates to the content that's been shared today. So we just wanted to sort of position ourselves for anyone that's not familiar. Within the Chief Public Health Office, tobacco really sits in a couple of different places. One is in the Health Promotion Unit, where Laura and I work, and that's where the prevention and cessation work from the office primarily happens. Tobacco control also sits in environmental health as well, where we have a tobacco enforcement officer who deals with more of the protection side of things and the enforcement of the legislation that we have in place. So I'm just going to touch on our 3 pillars of tobacco control, which really have a lot to do with how successful PEI has been in the last 20 or 30 years in our approach to tobacco control and helping Islanders live tobacco-free. It's due in large part to the very purposefully comprehensive approach that we've tried to take, that we've been successful in decreasing the percentage of Islanders that are smoking daily by almost 50% since 1999. But what we've seen over the past decade is that vaping has started to gain popularity, particularly among youth and young adults. And so our approach to tobacco control has started to evolve to include electronic smoking devices or vaping products. So in terms of prevention, just prior to COVID, the CPHO had established a provincial tobacco and vaping prevention committee to bring together community and government stakeholders working in this area. And the committee was able to reconvene earlier this year and establish an initial priority area, which was around youth. And so a working group was formed that identified some initial actions that could be taken this spring to get a conversation about vaping really back on the agenda for our schools and for our adult influencers. So teachers, parents, community members, you know, it was really seen as important to get that conversation started that we had some good momentum with prior to COVID. And one of the desires that the working group had was to see some public education pushed out to complement the communication that we were doing to parents and students within the school system. So from that idea came a vaping public education campaign that's actually currently being led by the PEI Lung Association. It was kind of very fortunate, really, how the timing of that dovetailed so nicely with the release of this new and really important data around youth vaping use in PEI. So we're really being able to capitalize on that new information, I think. And so we're really thrilled to see how that's come together in a short time and how much it aligns with the new data that we have available to us. So another important element of our tobacco control program is protection, and specifically that's the legislation that we have around the sale and the use of tobacco and vaping products. So we have a fairly comprehensive Smoke-Free Places Act in PEI that was amended a few years ago to take vaping into account. And so vaping is prohibited anywhere that tobacco smoking is prohibited, along with any signage or promotion of vaping products as a smoking cessation aid. And then in 2019, we had a private member's bill passed in the legislature that recommended 3 key amendments to our other piece of legislation, which is the Tobacco and Electronic Smoking Device Sales and Access Act. So when that legislation was passed, there were 2 amendments that came into effect on March 1st, 2020. The first one was that the minimum age for purchasing tobacco and nicotine vaping products in PEI increased to 21 years of age. And the second amendment was that the sale of nicotine vaping products was limited to age-restricted tobacconist shops in PEI. So those are stores that only people of legal age to purchase the product can enter. And following that, there was a bit of a consultation around the issue of flavored vaping products. That was the third component of the amendments. And in the end, the government made the decision to prohibit the sale of all flavored vaping products in PEI with the exception of tobacco flavor. And so that flavor ban just came into effect here in PEI on March 1st of this year. So I think, we've seen a lot of movement in this area over the last year, and I think we're proud of that, but certainly there are still areas that we would be looking towards. And in some respects, we're waiting to see what the federal government is going to do in this area, because they have a number of consultations and considerations underway about some regulations. Nicotine concentration limits, as has been mentioned, is a priority area, as well as vape shop licensing and taxation, and possibly some the language to address some of the issues that are emerging around flavor additives for unflavored vaping products. So those are just a few examples of things that we'll be looking to in the days ahead in this area. And the third element of our tobacco control program is cessation. So really, over the last couple of years, we've been so fortunate to be able to implement a universal smoking cessation program here in PEI that offers supports to users of tobacco products. However, with all of the mixed messages around vaping as a harm reduction product or a potential tool for some to stop using cigarettes, the picture around supports for vaping cessation itself has been less clear, but we are increasingly hearing from all angles that support for people who want to stop vaping needs to be a priority and given some more attention within the work that we're doing in this area. So at this time, our primary referral source when it comes to cessation related to vaping is the Smokers Helpline that does offer coaching support to anyone looking to quit use of nicotine-containing products. We are also watching emerging supports being developed in other spaces, which I'll speak to in just a little bit. And then we do have our smoking cessation program, which is undergoing an evaluation right now, and we will be looking to make some changes or adaptations to it in the future. So just as a quick overview of what our cessation program is for anyone who's not familiar, what it offers right now is it offers any PEI residents who smoke or use tobacco products the ability to access nicotine replacement therapy or smoking cessation medications once per year, free of charge. And this is accessible through healthcare services in our community pharmacies. So the client journey sort of looks like this. The process can be initiated by the client themselves if they're ready to quit, or it can be initiated in conversation with a healthcare provider. But access to the program is through our primary care networks across the island, where there are registered nurses that conduct the assessments and enroll patients in the program. And then access to NRTs or medication is through our community pharmacies. And in conjunction with that, patients in the program are supported really as they choose, but in a variety of ways. They have access to follow-up support from the primary care networks or from the Smokers Helpline. So just a few program highlights that Laura had wanted me to mention. There are, of course, the component I mentioned around the nicotine replacement therapy and medication, which is really important. But we know that the counseling support around for cessation is critical as well. And so that is something that was built into the design of the program, but it's something that we are increasingly looking at how we can enhance as we move forward. We do have an annual promotional campaign to keep the information about the program in the public eye. And we've also are just coming to the end of a fairly large evaluation process for the first year of the program. So the evaluation has been looking at some things like looking at the program's impact and effectiveness, looking at the quit rates, for example, but also doing an evaluation of the program providers themselves. So talking to the nurses that have been implementing the program and trying to learn from them to make decisions about where to go with the program in the future. So as you can see on the bottom of the slide here, as of May 31st of this year, so about 18 months into the program, we've had over 2,000 Islanders enrolled in the program and make a quit attempt. And when looking at the age-specific data, just this isn't something that we've really talked about before, but just given the age range we're talking about for this presentation, we did see that we had 32 island youth between the ages of 16 and 24 that enrolled in the smoking cessation program between December of 2019 and this past month, which is kind of interesting. And this is just a graph that sort of shows how those 32 island youth break down. So you can see the largest number of them are in the 1997 age category. So those would be the 24-year-olds, and then it drops off from there as they get younger. So I will just note that for these youth to be enrolled in the program, they have to be using a tobacco product. It is very possible that they are dual users and that they also use vaping products, but at this point they wouldn't be enrolled in the program if they were solely using vaping products. And I think we're increasingly seeing that is an area that we need some more targeted intervention, both in terms of sole vaping use, but also for this age group. I think that is an area of future growth. So in terms of next steps for cessation supports in PEI as it relates to vaping, we just wanted to acknowledge that there is a lot of other work being done right now in other areas about cessation with youth and young adults. One of the pieces that we hear a lot about from our practitioners here is the lack of clinical guidelines around NRT use for vaping cessation, and even more concrete guidelines around the counseling component for vaping and how it might differ from tobacco. But there are guidelines that have been developed that are coming out of credible organizations like the Canadian Pediatric Society, for example, has some new information on that. So those are things that we're looking into and looking to bring to our practitioners here in PEI. There is also a lot of apps, texting, and online supports that are being actively developed by other organizations, which we're really interested in to see how we could incorporate something like that into our program in the future. And so given all of these things that are happening and the research that's being done, we're taking a bit of a wait and see approach in some respects right now to get the results from our evaluation of the first year of our program, and then looking at how to be responsive to those evaluations to meet the practitioners' needs that they've identified around being more comfortable engaging in conversations about vaping and vaping cessation with all patients, but particularly with the youth and young adults that they see. And then we will look to see how we can use the things being developed in other provinces to complement our own services that we have. So I think I will leave it there.
Thank you so much to our presenters for taking the time today to provide those presentations. I think that PEI has a lot to be proud of based on the legislative changes we've made over the last couple of years, as well as our cessation program. However, given the data that was presented today, I think that it's clear that a lot of work still needs to be done to protect vulnerable youth islanders. So we're going to now open it up to questions. Okay, well, I just wanted to ask Dr. Alhamdani, just given the list that you provided during your presentation, I know PEI already does have the 21 requirement for tobacco and vaping products, as well as the flavor ban, but with the other ones that were on the list, what do you think would be the next most important step for PEI to take?
So just keep a close eye on the nicotine caps. I don't foresee the federal government doing anything but implementing the 20 milligrams per ml on cap on nicotine. So I think it will happen. I'm fairly confident it will happen at the federal level. But if not, I would suggest that the PEI government make a swift move and cap those concentrations. And I will remind you of the one slide where I showed the percentage of youth and young adults that use 50 to 60 milligrams per ml. And particularly, and also the one statistic with male youth, so the 16 to 18-year-old males in PEI, I think it was like 86% use 50 to 60 milligrams per ml. So hopefully there will be a quick action from the federal government, but if not, quick action is needed there. And regardless of where the federal government goes with policy, I like what Melissa has presented in terms of how the PEI government is keeping an eye on different options for cessation. I am aware of vaping cessation tools that are being developed, and I think some of them have a lot of promise. Text message based vaping cessation will be very, very helpful, because the policies will, you know, whether provincial or federal, will help prevent new youth from using the products, but for those that are currently addicted to the product, and even if they switch to a lower concentration product, they would need quite a bit of help, and those text message interventions, I believe, would be very helpful. We can't wait too long for the guidelines to come out of a place for with respect to NRT use. So we start with the text messaging interventions, and then once we have something about NRTs and how they can be used for vaping cessation, they can complement the text-based interventions.
Great, thanks. I think it's really tricky with the lack of guidelines. I know that that's been a feature of many of our tobacco prevention meetings, talking about sort of, you know, how to help youth that are addicted, but without those sort of set guidelines in place that our physicians can kind of administer, and our nurses and all our other teams that support people to try to quit smoking. So definitely something that we need to, stay tuned, but also keep on looking into those new programs or options that are 2020. Do you foresee that if we did the survey again next year, that those numbers would be different? I mean, I guess that's kind of hard to sort of anticipate, but do you think that youth are getting these products elsewhere, or what's your opinion on that?
I think definitely the numbers will go down. It might not be, it's not going to go down from 90% to zero in 1 year, but there will be a substantial change. One of the factors that sort of prevent the aggressive decrease in acquiring flavored products would be the fact that we're in a pandemic, and enforcement becomes a much harder job with the resources being limited for the government and being diverted to other things. And that doesn't apply to vaping only, it applies to other things. So I think as we come out of at least the vaccination stage of the pandemic, and with things opening up a little bit more, I think there will be stronger enforcement, and there will be time for youth and young adults to absorb the legislation. I mean, it was only implemented 3 months ago, and we should be able to see some change for sure. Yeah, because you MPI have implemented other policies as well, so that's always very helpful. One policy doesn't usually lead to an aggressive decrease in rates, but a suite of policies does.
I think if I could just add on to that, I suspect that something that may contribute to what we see in a future data collection, maybe the extent to which these flavor ban policies are implemented in other provinces as well, because I think one of the challenges with us not having a federal policy around flavors is that we are still kind of at the whim of all of the online sales coming in from other provinces. And I know for us, we're sort of in a bit of a unique position in PEI on our literal island, but when our bridge opens up to New Brunswick, until such time that they align their policies with us in Nova Scotia, just like we saw with canned pop, I heard when that happened, we're going to see folks going over there to access these products physically, as well as continuing to get them online. So I just feel like that is something that it speaks to the importance, I guess, of aligning policies.
Definitely. No, I think that's really important, especially with how close we are to New Brunswick and how many islanders, go over to Moncton to go shopping. So I was really happy to see that there is some movement from New Brunswick to have a flavor ban passed. So hopefully that will go through and be more of a Atlantic or maritime flavor ban in effect. I think that would have a bigger impact for sure. Says great strides on current legislation. However, what is next? Are additional items currently in the works? ? Are there items which are clearly under provincial legislation which other provinces have moved on, including taxation and licensing, as Melissa did mention? So I guess that's sort of for Melissa.
Yeah, I think that's exactly it. As I had mentioned, looking at the movement that's happened in a lot of other provinces, what we haven't looked at yet would be around licensing and taxation. Those would be some things we've seen a lot of movement on in other provinces in the last few months. So I think that's something that we would be looking at as a logical next step.
Great. And just for clarification, currently vaping products aren't taxed the same way as tobacco products, so they don't have the same kind of tax. Can you just maybe clarify that a little bit more? I think that's something that not a lot of people know.
I guess I'll speak maybe just briefly to the licensing. It's not my area of expert knowledge, but my understanding is that what we're finding is our vaping retailers, they don't have licenses the way that our tobacco retailers do. So when our vaping retailers are selling products to minors or are violating our legislation, we don't have that tool to use, to take away their license and prevent them from selling. That's not a tool we have, but we know it's an effective tool for tobacco retailers because it can be quite a hit to their revenue. And that's just one of the elements of the benefit of the license. There's, some accountability and being able to monitor who is actually selling these products in your province. So that's one of the reasons that we would look to that. And taxation, I think, has been done maybe different ways in different places, but it would be the idea of having a separate tax put specifically on vaping products in an attempt to make it more cost prohibitive so that it's not as easily accessible.
Great. And Mohammed, do you have any specific recommendations around taxation that you would like to add to that?
Yeah, I would definitely. I mean, taxation is the most effective policy when it comes to tobacco control, and we've seen it with other legal substances as well, with like alcohol. Every time you increase that taxation, you get a decrease in use, and particularly amongst youth because they're more price sensitive, and it decreases affordability at a greater percentage in comparison to older populations. So it's certainly the way to go, and there's a lot of room to add aggressive taxations, because even with a very high tax on vaping products, they will remain at a much lower price point in comparison to tobacco, because one of the concerns always is you can't tax a product that is less harmful in a way that makes it that makes the more harmful product more appealing. But we're very, very far from that, because tobacco is way more expensive in comparison to vaping. So tax it, see the effect next year, and continue to increase taxation. And there's also other ways of alleviating the concern that I just mentioned, which is concurrent increase in taxation for both tobacco and vaping. Every time you would increase taxes on vaping products, you increase that as well for tobacco. So that would discourage substitution.
Great. No, I think that's a good point. I was very surprised how cheap, you can get vaping products on PEI, especially some of these new products that are coming out, the disposable vapes that you don't even have a new pod, like it's less than $20 for your whole system, battery and everything, right? So that's definitely something that's very accessible to many young islanders. So definitely concerning for sure. Okay, well, I think if anyone has any last questions, feel free to ask them now, but I think we're going to end our webinar for today. I thank you again to our presenters. That was a lot of really great information. Anyways, thanks again to everyone and have a great day.